brought to you by Dallas Renal Group and Zyga Healthcare Group. Dallas Renal Group provides comprehensive kidney care, including transplant and home dialysis services. Information can be found on dallasrenalgroup.com or the Dallas Renal Group Facebook page. It is also sponsored by Zyga Healthcare Group, a leader in providing senior living, home health care, and hospice-related services throughout the entire DFW Metroplex. Folks, my name is Dr. Parin Makadia, and I will be co-hosting today's show with Dr. Vik Prakash. We have several great shows scheduled in the upcoming weeks. More details on these shows can be found on our website, doctalklive.com. That's DOCTALK live.com. And also, if you're a healthcare professional and would like to be on our show, please send us a request through our website or through our Doc Talk Live Facebook page.
This is Dr. Vik Prakash, your co-host of Doc Talk Live. Today, ladies and gentlemen, we have a topic for you that I know everyone will be eager and excited to listen to. So let's get to it. We are going to be discussing primary care and preventative health with Dr. Deepa Chintala and Dr. Yamuna Gurrapu in the studio with us. To be a part of the conversation, give us a call. Our number is 972-235-5555. Again, that number is 972-235-5555. We'll be happy to take your questions live throughout the show. Dr. Chintala, Dr. Gurrapu, welcome to Doc Talk Live. Thank you very much for volunteering your time to be a part of this show. And please tell our listeners a little bit about yourselves.
Thank you, Dr. Prakash, for having us over on the show. I'm Dr. Deepa Chintala. I'm an internist. I've been practicing in this area for over 8 to 9 years now. And I've been a hospitalist previously, but I've opened my own practice at 121 and Independence for over a year. And we see all patients above 18, and we do primary care, preventative care, and all the screenings.
Thank you, Dr. Chintala. This is Dr. Gurrapu. I am internist and been in practice in the internal medicine in Frisco, Plano, McKinney, and Dallas from 2008. And recently we opened internal medicine practice at 5350 Independence Parkway, which is in Frisco actually. Thank you for having us today.
Excellent, doctors, Dr. Chintala and Dr. Gurrapu, thank you again for coming on our show. Let's get right to it. Dr. Chintala, CDC now reports that 7 out of 10 deaths in the United States are caused by chronic disease, while roughly half of the country's population has been diagnosed with chronic illness, including heart disease, cancer, diabetes, HIV, AIDS, or other conditions. Statistics like these signal a need for greater national emphasis on a proven preventative approach to healthcare. Can you please explain to our listeners what is a preventative medicine in adults and why is it important?
Well, the preventative medicine is a major part of the primary care. It is the goal to protect, promote, and maintain health and well-being to prevent disease, disability, and death. For example, for screening for hypertension and treating it before it causes diseases like heart attacks or strokes. If we catch it before, we can avoid this. It is recommended that adults and children should visit the doctor every year and be screened for high blood pressure, for diabetes, and for colon cancer screening in adults, cervical cancer in women, and along with breast cancer, and multiple other screenings and immunizations and vaccinations have to be done and maintained up to date.
Folks, you're listening to Doc Talk Live. We have in studio with us Dr. Chintala and Dr. Gurrapu. We're discussing primary care and preventative health. Again, this is primary care, so the questions can be broad. Feel free to call us, 972-235-5555. Dr. Gurrapu, what age group do you treat? And what are some of the things you feel is important for your patients to share with you before they come for their visit?
Thank you, Dr. Prakash. As we are internists, our patient care starts from 18 and above, which is basically very important age, entering in the adult group. Before the patient arrives to our facility, typically we expect their old medical records and any medications, completed medication list, and family history and immunization history along with them, so that the treatment process can proceed smoothly.
Excellent. Dr. Chintala, should you still go for a yearly checkup with your PCP if you feel fine? And also, if you could talk about some of the cardiovascular cancer screenings that a primary care physician does.
So even though if you're feeling fine, which most patients do, we cannot diagnose you with high blood pressure. You can be walking around fine with a blood pressure of 180, and one day you can end up with a stroke or a heart attack. So I would strongly recommend that you go to your doctor and have yearly screenings done so that we can diagnose these diseases ahead of time before it strikes you with the axe.
Go ahead.
Sorry.
I was just going to say, with my own patients, I often tell them it's sort of like car maintenance. You have to take your engine and get an oil change every few months. Well, it's a lot easier to replace a car engine than it is to replace a heart or a kidney. So it's very important to keep getting checked out. So, Dr. Gurrapu, when should you start osteoporosis screenings, and is osteoporosis preventable?
Thank you, Dr. Prakash. So the osteoporosis is a brittling, the bone get brittle and easy to get fracture. So the earlier the screening is better. Typically, we start screening in women more than 65 years and men more than 70 years, but that is a recommendation. However, if the patient is having any risk factors like fractures or arthritis, rheumatoid arthritis, and if the patient is being on steroids, then yes, we start early.
Let's take a live call. Hey, welcome to Doc Talk. Oh, we just missed that one.
So we were talking about screenings. Dr. Chintala, what are some of the cancer screenings that you would recommend for patients?
For cancer screenings, usually the most important one is the colon cancer, which we start screening at the age of 50, or if you have a family history, we start the screening earlier with a colonoscopy or testing the stool for any blood in the stool. And then in women, we have the breast cancer screening, which we do the mammograms yearly after the age of 40, depending on the risk factors. Again, it can be earlier. And the pap smears, routine pap smears, are recommended for early diagnosis of cervical cancer. Again, if the patient has a lot of risk factors such as smoking, we do recommend lung cancer screening, but that depends on individual basis.
Let's take another live call. Hi, welcome to Doc Talk. What's your question for our experts? Great question.
Yes, great question. Yes, when there is anxiety, your blood pressure always goes up, but this is short term. Once the anxiety situation is resolved, your blood pressure should come back to normal. But if it doesn't, then you have a baseline high blood pressure.
This is Dr. Gurrapu. I would like to add also that anxiety is the trigger of releasing stress hormones. The mechanism is, whenever there are stress hormones, a lot of cortisol and stress hormones will trigger the high blood pressure. So it's important to treat both together.
Excellent. For the folks who are joining us, you're listening to Doc Talk Live, and we're in the studios with Dr. Gurrapu and Dr. Chintala discussing primary care and preventative health. And the number to the studio is 972-235-5555. Dr. Chintala, what immunizations are necessary for someone less than 65 years of age, and then also over 65 years of age? And is there any difference in the age group for preventative care?
Yes, thank you, Dr. Makadia. The immunization for below 65 is the yearly flu vaccination, and we have the tetanus vaccine, which is given once every 10 years. But if you have a newborn baby at home, we always recommend the Tdap, which covers the whooping cough, so that we don't give it to the kids. And also the varicella vaccination if you have any immunity problems, and also the shingles vaccine, which is given a single dose for people above 50, and the HPV vaccine, which is given for younger females below 26 or males below 21. And the pneumonia vaccine is given if you're below 65 and have risk factors like diabetes. But if you're above 65, you do need 2 doses of the pneumonia vaccine. And so from the screening standpoint, when you're above 65, in addition to the regular cancer screenings, we also screen for depression, we also screen for socioeconomic issues of abuse and alcohol, And in addition to that, the main issue is abuse in adults that we have to screen for. Thank you.
Let's take some live calls. Hey, welcome to Doc Talk. What's your question?
Yeah, thank you for the question. It's a good question, but yes, the stress can do a lot of issues, like by releasing all these stress hormones and having issues in the stomach also. But going into dangerous situation, that has to be definitely discussed by the primary care physician. I would really recommend, talk to your physician and see anything else going on rather than the stress issue.
Let's take another live call. Hi, you're on the air for Doc Talk.
I have a question regarding if there's any correlation between vitamin D deficiency and
If you could turn down the radio in the background.
high cholesterol.
Okay.
So the question is vitamin D and cholesterol. Basically, we have a cholesterol which is helpful to synthesize the vitamin D. So we have a fat layer under our skin, and whenever we have a good sun exposure, the both together have a good vitamin D. But having high cholesterol and high vitamin D, I don't think so.
Let's take one more call. Hey, you're on the air for Doc Talk. What's your question?
Hi, I was calling to find out if you're a healthy female, but you have a huge family history of heart disease. What would be the best way to go about disease to see if you're at risk?
This is Dr. Chintala. Thank you for the question. If you're a healthy female with no obesity and no history of hypertension, hyperlipidemia or obesity and diabetes, then your regular annual checkups for these to avoid these risk factors is good enough. You don't need any additional testing.
Let's take one more call before the break. Hey, welcome to Doc Talk. What's your... Oh. Hi, welcome to Doc Talk. What's your question?
I have it from the water something. She has this on trail.
Excuse me, sir. We're actually about to head into our break, so I'm going to pick up your line during the break, and you can ask it there, okay? You're listening to Doc Talk Live. We'll be back in 5 minutes.